We're deeply concerned by the news that a healthcare worker in Texas has tested preliminarily positive for infection with Ebola virus.
The CDC director announces that the nurse who cared for Thomas Eric Duncan, the Liberian patient who died of Ebola last week in Dallas, has tested positive for the virus. This is the first case of transmission in the United States, and the diagnosis has brought into question Ebola safeguards as the nurse was wearing protective gear and considered low risk. Good morning and welcome to the News Hub. I'm Michael Casey. With more on the story, we have WSJ Atlanta Bureau Chief Betsy McKay. So Betsy, hi there.
Hi.
What do we know about how this health worker contracted the virus?
Well, that's what investigators are trying to figure out now. She was one of many healthcare workers who cared regularly for for Thomas Eric Duncan, the Liberian patient who became sick with Ebola once he reached the U.S. He was sick in the hospital for about 10 days, and she was caring for him then. And we know that she was wearing protective gear recommended by the CDC, which is, a gown, gloves, a face shield, and a mask. Two of the things that the CDC said, which has sent, additional people to Dallas now to investigate, they say they're going to look pretty carefully at two things. One is when kidney dialysis was set up for Mr. Duncan, and the other thing is when he was intubated. Those are two procedures that can cause a lot of bodily fluids to emit, and she could have possibly have infected that way.
So what does it mean now for the treatment of Ebola in the United States and I presume the protocols that are being followed?
Well, everybody's taking a hard look at this. I mean, this was not supposed to happen. And it's very unfortunate that it did. As the CDC director said yesterday, protecting yourself from Ebola as a healthcare worker can be done. It's hundreds of people have cared for Ebola patients in Africa, and the vast majority do not get sick. But it takes meticulous attention to protocols. And something happened, and so this raises the question generally of how well prepared all hospitals are to deal with this. It's very labor intensive. It requires, scrupulous work and attention. And, it still remains to be seen what happened here. And that will say a lot about this hospital and what needs to be done in other hospitals.
And what about the diagnosis process? Was there mishandling of the case of Thomas Eric Duncan, and what are we learning from how doctors should actually approach, possible cases going forward?
Yeah, there have been, a couple of unfortunate things that happened here. And the first was that he came to the hospital originally, to the emergency room, complaining of symptoms. The initial symptoms of Ebola could be a lot of things. It's fever and abdominal pain that he had. And he was sent home with antibiotics. He did apparently say that he had been in Africa, and that was not picked up. He was brought back 4 days later by ambulance, very sick this time. So he was extremely sick by the time he was admitted. Other people were exposed in that time that he was brought back 3 days later. People were exposed during that time. And then, but this nurse was infected after he was in the hospital. So that's a second step. And now, health officials are going to need to follow more carefully all the healthcare workers who had access to Mr. Duncan while he was in the hospital.
Well, thanks very much, Betsy. This is going to be obviously an intense story going forward. Appreciate your time.